This is Jeff Jameson. I'm a family practice physician that does stem cell or concentrated bone marrow therapy for folks. And you were my very first patient when we did this. And I thank you for that. So tell us what we did. What was the problem that you had with your knee that you needed to have something else done?
Well, first of all, I had already had knee replacement in one knee and a partial in my other, and I was having problems with my knee again.
Which knee was having the problem?
My left knee. And that was a partial, and I didn't want to have to go through surgery again. So we looked into stem cell. We were looking at some programs that were offered out in the valley, and we did not like the way they were performing the program. And so when I heard how Dr. Jameson planned on doing it, I thought, well, this is doable. So
well, that's really fun, and it's been very interesting to follow you over these last several years. How long ago was it? Was it about 6 years ago?
At least. What year was it? You're the one that has the record.
Well, I don't have the record in front of me. So I think it was about 6 years ago. But as my very first client for this, you were very trusting in what we could do. And so I'm just grateful that we've had such a good result. So when you were experiencing problems with your left knee, the one that had the partial, what pain would you say you were having? Were you having difficult walking, going upstairs? What kind of problems were you having?
All of the above, everything that there, it was to the point where I needed something done. And I didn't want to have surgery. I already did that. It's no fun because it takes so long to recover, plus all that swelling and all of that stuff. And so I felt like I wanted to give this a try. And I am so grateful that I have. And I still am using my legs very well. I'm walking at least 10,000 steps a day. I'm so grateful I can. And I'm busy doing many things. I just turned 80 and I am loving this. I've recommended it to several of my friends and they've had it done as well.
Well, that's really fun, and we've been really grateful for your referrals as well. So tell me, once we brought you in for the procedure, did you have any trepidation or things you were worried about going into it?
No, because you told me exactly what you were going to do, so I didn't have any surprises. And actually, I was surprised that it was so easy. It went so quick, and it was really very pain-free. And you took care of that.
I am so grateful to hear that. Although I wonder if it's been so long ago that you can't remember, but no, probably not.
Well, that could be.
No, but I recall the procedure very well, especially since it was the first time I had done it.
I'm sure you
did.
did.
And as such, I wanted to make sure that you had as little pain as possible. So especially in the drawing the part of the bone marrow from your hip, do you remember the pain involved in that?
I remember it was there, but it was pounding on your bone, trying to get that needle into there. It was not what I expected it to be. It was not as difficult. And I believe you gave me a Debbie.
Yep. We did numbing medicine around the area.
And it really was surprisingly went well. I remember I was surprised how well it went.
And it certainly is fast.
I remembered that.
I'm so glad. So after that was done, when we took the bone marrow from your hip, about 15 to 20 minutes later, we were prepared with a vial to put into your knee. How was the injecting into your knee portion of it? Was it hard for you?
Well, I don't remember. It's kind of like childbirth. I don't remember how hard it was.
Yeah.
It was worth it though, because I remember how hard the surgery was.
Yeah.
And that was so little discomfort that we had for that was worth every bit.
So after the procedure was done, how long did it take for your knee to really start feeling better?
You know, I think it was just within a few weeks. It was gradual, and I did have very little swelling, and I just don't remember it being a difficult time. And it's 6 years, and I'm still doing well.
Which is fantastic. And this is one of those items where your mileage may vary depending on your health and other things. So a 6-year result is something I don't tell people that they're guaranteed to get. But the fact that you've had 6 years of good health in that knee is really amazing, and I'm so grateful that you have.
Well, can you guarantee how many more years I can have?
No. Yeah, that's the thing about us humans. We can't guarantee much, but we sure try hard.
I know.
Yeah.
I'm just really pleased that I'm doing as well as I am.
So tell us what you can do with your knee now without much pain. Can you go up and down stairs pretty easily?
I go up and down stairs constantly.
Okay, and you said you walk more than 10,000 steps a day?
Absolutely.
Does that make it so that at night you are really uncomfortable, or can you sleep through the night without much pain after that?
I don't have much pain. I take very little pain meds.
Very
It's
good.
Tylenol or whatever. If I push it and have a really heavy day, I might have a little issue, but I really get along pretty good. I can't complain at all.
Well, that's what we hope for. Now, I'm so grateful that you've been able to have this knee be in such a good shape for so long. And here's to another 5 years. What do you say?
At least 5. At least 5.
That's great.